In this video, I am going to speak about an interesting topic. What if ImmuLIT fails? I am Dr. Mohan Raut. I am practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology, in different parts of India. It is in Mumbai, Pune, Nagpur, Bangalore, Hyderabad, and Delhi. And at these centers, we treat couples who have unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using our unique patented process of ImmuLIT immunization therapy and other immunomodulatory medications. So let's come to today's topic. What if ImmuLIT fails? Now you all know ImmuLIT is an active immunomodulatory treatment. It is the patented and branded form of lymphocyte immunization therapy that is practiced at our center, that is Dr. Raut's Center for Reproductive Immunology. To briefly tell about ImmuLIT, that this is a one-time 3-hour process, and what it involves is use of lymphocytes from the husband or a donor to induce immunomodulatory changes in wife. These cells are injected in wife, and these cells have the ability to induce the blocking antibodies and the protective T-regulatory cells in wife, thus causing immunomodulation and protecting pregnancy in couples who have, as I mentioned, unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility. This is also useful in couples who have uh, early onset history of early onset preeclampsia in the past, which is also because of the immunological or alloimmune problem in the couple. And when the pregnancy escapes the first trimester attack, it may manifest in the form of early onset preeclampsia, which may cause even pregnancy loss. So this is about ImmuLIT. And as I said, the indications are the reproductive failures. Now, the success of ImmuLIT depends on certain important factors. And if these factors are not considered or if they are not followed, then there are chances that ImmuLIT may not be successful. Of course, here let me tell you one important thing, that any medical treatment is never 100% successful. So there are the success rates may vary depending on the individual, because finally the way each individual reacts to a particular treatment is different. So there are certain factors which decide the success of ImmuLIT, and to tell about these success factors, to know these success factors before discussing about what if ImmuLIT fails. Now the success of ImmuLIT depends on, the first most important is proper selection. You have to select the couple properly by doing the immunomodulatory, the immunological investigations, and if they indicate that ImmuLIT is going to be beneficial, only then the couple is selected for the treatment. Second is the rule out or other possible causes of reproductive failure, either miscarriages, IVF failures, or infertility, because and if they are there, then they should be treated simultaneously so that the immunomodulation with ImmuLIT will be successful. And of course, the right technique of doing the ImmuLIT procedure, and that is the lymphocyte immunization therapy procedure, and done by the right personnel, I would say, at right place, is also important. But many a times patients ask us, and I remember distinctly, there was a couple who had 11 miscarriages, and when she was referred to us by a gynecologist, and the first question when we told her about the immunological factor and possible role of ImmuLIT in her case, the first question that she asked was, "Doctor, what if this ImmuLIT fails?" Now I told her this is the first time we are considering an immunological factor, so I think it is not right to consider about failure first. But yes, I understand a couple who has gone through so many failures, maybe either miscarriages or IVF failures. The first question that comes to their mind is, this next treatment also may fail, and what after that? So therefore, I want to address this important issue in this video, that what if the fails. Now, what are the chances, what are the causes of failure? Now, coming to the first cause is, if the or if this immune treatment is given to a couple without finding out whether they really need it, then that is definitely going to fail. Because the first point which I mentioned just now for success is proper selection of couples. So we do certain immunological investigations, and if they indicate, only then immune treatment is given. An investigation that we recommend is lymphocyte cross match. Now, a lymphocyte cross match report which is negative is an indication that the immune treatment will be beneficial for the couple, because it detects the antipaternal antibodies, and if they are already present, then there is no role of immulit. So if immulit is given to a couple who is already the lymphocyte cross-match report is positive, or that test is not done and given to the couple, and that couple the report happens to be positive, then yes, definitely the lymphocyte immunization therapy treatment is going to fail. So therefore, before giving immulit at our center, this is a mandatory test that we do to rule out that the lymphocyte cross-match is not positive. Now, this other second thing is about uh, presence of other causes for reproductive failure. Now, if the couple has, say, autoimmune problem which has not been detected, or which, if it is there, it has not been treated, then in that case the lymphocyte immunization therapy may fail. Third thing is, if the procedure that is done, the way lymphocyte immunization therapy is done, if it is not the right way, because lymphocyte immunization therapy is not a simple procedure. It's not that just you separate lymphocytes and inject whichever way you want and it will cause the effect. No. So the starting from the separation of lymphocytes to the exact the quantity of lymphocytes, all those factors, and the route of administration, the correct way of administration is what is important. And if that is not done the right way, then the lymphocyte immunization therapy may fail. Then third thing is, the lymphocyte immunization therapy induces, as I said, protective antibodies and protective cells. And this immunomodulatory effect is complemented by certain passive immunomodulatory medications. So these passive immunomodulatory medications are decided depending on the immunological test reports, and an individualized protocol is given to the couple. So if the passive immunomodulatory medication that is required for the couple is not given in the right way, then again there are chances that the lymphocyte immunization therapy or immulit may not give its optimum result. So that is another cause why the immunological treatment may fail, especially in case of where the embryo transfer has been done with good quality embryos. So not all embryo transfers are with genetically tested embryos. So a couple who has previous failures, there is always a possibility of a genetically abnormal embryo or genetic abnormality in the embryo if the genetic testing is not done. So therefore, a genetic testing of the embryo, and if that also has failed before, then definitely that is an indication. And if the immulit fails, there is always a possibility of genetically abnormal embryo if that is not tested before. Certain centers do the endometrial receptivity test, the ERA test, endometrial receptivity assay, and if they accordingly, if the receptivity is not the right, is not correct, and if that time the transfer is done, then again there are chances of failure, especially if the receptivity test is not done. So what I mean to say is, the other factors which are not which are responsible for the failures must be taken care of properly to ensure that the immulit treatment fails. But in spite of doing all these things, if immulit doesn't succeed, then what? Now let's come to the success rate of immulit. Treatment that we give immulit at our centers has been associated with a success rate between 75 to 80% for these couples who have been selected by doing the test which I already mentioned, the which are by ruling out other causes which I already mentioned. Here I would like to tell one more thing which I always say in my videos, that these patients of say repeated miscarriages, recurrent IVF failures, unexplained infertility are referred to us by infertility specialist or gynecologist. We treat these couples at our center, and these patients go back for the fertility treatment to the respective doctors. And so we get the feedback from these doctors about the possible about the success or failure of these patients. And that is the data that I am sharing with you. So, as I said, almost 75 to 80% couples succeed. So, what about the remaining? Now, the question that the patient asked, what if LIT fails? What will you do? Because the ImmuLIT procedure that is done at our center is a one-time process, and the effect lasts for almost 18 months. So if a LIT has failed, immediately there is no need for to repeat the dose of ImmuLIT for that couple. So first thing that is done is a thorough counseling is done with the patient. Patient is explained about the possibilities why it might have failed, and the discussion is done with the referring doctor for possible cause of failure in this particular cycle, if it is IVF, or a particular pregnancy if it was a natural conception, and what additional can be done is discussed, and accordingly the couple is advised for further treatment by the respective doctor. From our side, follow with the couple and with the doctor, and in the subsequent cycle we ensure that the required medications are given by the doctor so that the adequate effect of passive immunomodulation is also achieved. And the other thing that one more scenario that we often face is we get patients who have reproductive failures and they have taken lymphocyte immunization therapy at some other centers. Now, because a lot of doctors are aware about the efficacy of lymphocyte immunization therapy, and they have started some of them to the immunological treatment at their respective centers. And or before this also there were a few doctors who were doing it, and many times we get couples who have taken these treatments at these centers and they have not succeeded. So in those cases also, of course, there will be similar factors which might be playing, that is success is never 100%, but the factors that lead to failure have to be ruled out. So if we get such patients who have failures after the LIT procedure at some other centers, we again counsel them. We see that any other existing factors are there, and accordingly, so that those factors get corrected. And these patients, if the immunological investigations still indicate, like say lymphocyte crossmatch is negative, then we recommend ImmuLIT treatment to them after previous failures. And we have many couples like this who have uh, taken this treatment before and they have not succeeded, and subsequently they have been given. I distinctly remember a patient whom I had seen in Delhi, and she had taken lymphocyte immunization therapy 3 times. 3 doses were taken. She had 4 IVF failures, and she had unexplained infertility. So we explained to her about the possibility of repeat or the immune treatment, requirement of immune treatment at our center, as her investigations were indicating. But she wanted to know what different we are doing at our center, so we had to explain to her about what we are doing. And after that, she underwent immune treatment at our center, and the couple conceived naturally after that. And recently, she had sent a nice message thanking us that she had delivered and she had a healthy baby. So we have many such instances where the previous lymphocyte immunization therapy has not worked, after giving ImmuLIT, they are successful. The point to tell you all is lymphocyte immunization therapy or ImmuLIT fails. That's not the end of the world. Okay, so there are patients who have been successful, who have failed before, have been successful with ImmuLIT treatment when we are given at our center. And the second thing is, no medical treatment is 100%, so there are always chances of failure. So when we come across failure, that is, if immediate treatment fails, so in conclusion is we counsel the patient, we go into the details of the case to find out whether any other factor which was responsible for not succeeding at that time. And thirdly, if we discuss this with the referring doctor, and accordingly a treatment plan is suggested to the couple, so that in subsequent cycles they are successful. We are also have seen patients who have not been successful after ImmuLIT treatment. They have miscarried after ImmuLIT treatment, but subsequently in subsequent attempt the pregnancy has continued successfully and they have done well. So friends, ImmuLIT fails is not the end of the world, and there is always light at the end of the tunnel, as we say, and there are always chances that subsequently the couple will be successful in having a successful pregnancy, and as I always say, their dream of having their own baby. Thank you.